All right, and I'm gonna let Paul do his thing. So so for you guys that don't know, like, and I know some of you guys were on the last call that we did, and some of you guys weren't, and that's awesome. I love that we have a more full house today. But I want to reintroduce the FFL Health team. Obviously, I'm Eric Amati. You guys know me. I've been talking to you for the last year. We've got Christina Rose on here. Christina, if you want to wave.
Janizer.
Oh, that's right. Sorry, Christina Janizer. Showing up with Christina Rose in your meet group there, but she is oh, you know what? I am sharing my screen here. I don't need to do that. Oh no, somebody else is sharing their screen. Oh, it's James. James, if you want to stop sharing your screen, that's cool. Because Paul's going to do that. But yeah, Christina's last year got into she started this life, and then she got into all the health products and just blew it up. Wrote over 100 apps in the last couple months of the year. And it really has taken on a passion for health, not just health insurance, but all the other plans that we have, the Medicare, the short-term health, the supplemental, all those things. She's become really quickly an expert on it. And Christina, just so pumped to have you in here.
Thank you.
Smith, who's was really I want to call him the OG of FFL Medicare back in the day. He's been at FFL since 2015. So going on almost 10 years, 9 years this year. And he was one of the first ones that kind of started piloting FFL MedSup back 7, 8 years ago. And has been in Medicare ever since, and has a really great team. And then Paul Sutter is going to be doing the training today. Paul used to work for the carriers based in Virginia. He's probably got more Medicare Advantage knowledge, intricate knowledge than anybody else I've had the privilege to work with in my career. I mean, he's like the Rain Man, not socially that great, but no, I'm just giving you a hard time, Paul. But he just has the command of the knowledge and the details at his fingertips. And so the thing I've challenged Paul with today is to keep it simple, keep it basic, so that everybody can kind of digest and come along in the learning. But Paul, dude, so thrilled that you're on here. Thank you so much for agreeing to venture with it, and then I'll turn the call over to you.
No problem at all. Turn off my camera and get some things going here. Let's see, share screen. Everybody seeing my screen?
We are now.
Yes.
Perfect. Well, this is going to be very short and sweet. I tell a lot of people that Medicare is an elephant. The only way you eat an elephant is one bite at a time. This is going to be a very short and sweet breakdown of kind of the history of Medicare, where Medicare came from, kind of give you an idea of where Medicare is going in the future and things of that nature. And I'll break it down into tiny little segments. Understanding Medicare starts with understanding the basics. It's like you can't be a master mechanic unless you understand that a car has 4 wheels and at least 2 doors, and then we build from there. So it's basically the same here. We're going to start with some very, very basic parts of Medicare and have a little bit of fun with it as we go, as much fun as you can have with Medicare. But quick history about Medicare in general. Medicare was invented in 1965. Part A was your hospital coverage, hospice coverage, different institutionalized coverages, things of that nature. And you pay into that system with taxes. Also in 1966, in the same bill, they implemented Part B, and that is your doctor visits. And essentially that's an 80-20 split. The government will pay 80%. The government, or you will pay 20% as the individual. In 1966, inflation and whatnot, doctor prices, that wasn't such a bad deal. I'm going to pay 20% of a doctor bill, not so bad. Okay, but as you can see, there was a long time before we touched anything in Medicare. Then in 1999, we came back with the Balanced Budget Act of 1997, and they came up with what is now known as Medicare Advantage. In 1999, it was called Medicare Plus Choice. Medicare named it that, not a private insurance company. But essentially, private insurance gives you your benefits rather than having A and B pay for your benefits. We'll get into that in just a second. And then finally, in 2003, under the, oh shoot, I forgot what the MMA stands for. I'm drawing a giant blank. I haven't had enough coffee this morning. But in 2003, under the Bush administration, they put in another act. So Congress acted again and activated drug coverage. Okay. And that went into effect in 2006. So as you can see, there is a history of the government's involved, the government's involved, the government's involved, the government's involved. Now, if you turn on the news, the government is involved. They're always talking about Medicare and changing it. Okay. This is the piece of the puzzle that gets changed the most, is this D, drug coverage. But there are pieces of the puzzle that change in all of these different segments from time to time. So let's go over what A and B is a little bit and how do you get A and B. For most people to get A, you must work 40 quarters or your spouse must work 40 quarters and be taxed. So as I often tell people, and for anybody that was seeing my logo there instead of my beautiful face, it says your shelter in a Medicare world. I often say Medicare happens to you every day, whether you want it to or not. Us now, we are paying our taxes. Our FICA and Social Security taxes pay for our Part A. So that's how you're getting Part A. Is you're working 40 quarters, you were paying your taxes. If you have a spouse that works and pays taxes, that's how they would get their Part A. You can also qualify for Part A if you have certain disabilities, ALS and end-stage renal disease. ALS is Lou Gehrig's disease. These are the most common, but there are others such as blindness and things of that nature that can qualify for early Part A as well. Okay. Otherwise, if you're getting your A and B, you must be 65 years old or disabled. So that's where the disability comes in. Your Part B, since you paid for Part A with taxes, once you enroll in Medicare Part B, then you start paying monthly premiums for your Part B. Those are based off of your income, and they do vary. So it could be zero that you pay for your Part B if you're on Medicaid. Okay, you could pay a higher income if you have a retirement income over, say, $180,000 a year. But that's how you get eligible for A and B. Just work, pay your Part B premiums when you're 65 or disabled and eligible for your Part B, and then you have A and B. So the government will pay for 80% of your drug or your medical costs, and you are on the hook for 20%. Part A, you paid your taxes, but there's also deductibles and copays that apply. If you were put into the hospital, you will have to pay a deductible of over $1,000 on day one of being in the hospital. That varies from year to year. These are where the things change a little bit. But then if you're in the hospital for more than, say, 90 days, you're going to pay for more copays for being in the hospital. We've already talked about Part B having 20% of that cost share. Now, as you know, and as you've probably heard, doctors' visits are getting more and more expensive every year. So that 20% becomes a bigger and bigger cost share for the member themselves. The other scary part about this is there is no cap on that. So if you have $100,000 in medical bills, you have $20,000 in bills that are coming out of your own pocket. This is how homes are lost in the Medicare system. So prior to 1997 in the Medicare Choice, or what's now called Medicare Advantage, everybody bought Medicare supplements. Not everybody. Some people still stay on their 20% with their original Medicare A and B. Okay. But most folks buy Medicare supplements. Before 1997, that was your option. So you were basically buying on price because you're going to be basing it off of how much are you going to pay for your premiums. They are standardized plans that do not coordinate with Medicare. Okay. So your hospital, hospice costs, and all of those copays and deductibles for Part A. And oh yeah, by the way, Medicare is super weird. If you just have Medicare A and B and you need surgery, there's a deductible for 3 pints of blood. So if I need surgery and I just have A and B insurance, I need to find 2 or 3 friends that are going to be willing to give blood so I can have surgery. That's how weird Medicare is by itself. So people were buying supplements to cover those pints of blood, cover those hospital and hospice charges. It also covered their 20% of their medical charges by paying one premium. Okay. You were only eligible for general, your guaranteed issue. You were starting Medicare or you were losing your coverage. Whoops, went back, sorry. But you had health questions after you lost that general or guaranteed issue eligibility. But there were no networks. Any doctor that accepted Medicare, you could see them. So it's very straightforward insurance. All you have to do is pay your premium, and they pay all of the 20% in cost their shares that are not covered. Very simple insurance. But as you age, those premiums go up. And as the Medicare population grew and grew, those premiums kept growing. So in 1997, when Medicare Choice came along, or Medicare Advantage now, that's where they got to Part C of Medicare. We finally got to the third letter of the alphabet. This replaces original Medicare because you have private insurance that pays 100% of the costs. You have your A and your B combined. There's no or you wouldn't have to have a drug card. You wouldn't, in most cases, you don't have to have a drug card. You don't have to have a Medicare Supplement card as well. So you only have one card to track. Sounds simple, doesn't it? The reason they named it Medicare Choice and now Medicare Advantage, and that was named by the government, is because you get extra benefits above and beyond Medicare. Because if you think about A and B, we talked about hospitals and we talked about medical. We did not talk about dental. We did not talk about hearing. We did not talk about vision. Okay. And in most cases nowadays, especially, most of your Medicare Advantage plans include your drugs as well. So one card is all of your different types of products. For those that were still on Medicare Supplement, they needed to get Part D. Okay, and everybody is required to have Part D drug coverage that is creditable when they are on Medicare. So it is required to have minimal coverage. CMS is the Centers for Medicare and Medicaid Services. Okay, that's the government entity. You hear everybody talk about, oh, we're afraid of the IRS. Oh, I fight CMS. I'm the same thing as an accountant. I see you every fall. I just fight CMS versus the IRS. Your costs. Part D, you're going to have premiums. You may or may not have deductibles. Co-insurance, co-pays may apply as well. Most drug plans that have a network, those are usually expansive networks of pharmacies and doctors. And when I say expansive, I'm talking 60,000 nationwide pharmacies and whatnot in most drug plans. You also have mail order options as well, which are generally cheaper. Drug plans have a funny name called a formulary. It's a fancy lawyer word for list of covered drugs. It varies greatly by plan. Even within the same company, you can have two plans that are in the same area that have different premiums because they have different drugs that they cover. All categories of drugs must be covered. So let's just talk about insulin. There's 600 and some odd different versions of insulin. They have to cover insulin, but they don't have to cover all 600 versions. So they may cover Humalog, but not Humulin, and vice versa. And then with the caps on the rising costs, there's what is called a TROOP, or a true out-of-pocket maximum in drug plans. This is the portion that changes most frequently in the Medicare space, because every year they try to close that gap of how much those folks are paying out of pocket every year. Okay. And so since then, we've had the Affordable Care Act, which Christina is very, very familiar with. That did have effects on the Medicare space. It started closing some of these drug costs in the Medicare space. Okay. The Inflation Reduction Act that they just passed a couple of years ago is actually closing this dollar amount even faster. So every time the government does something, I need to come in and save my clients. But the landscape, where they land today, right now there are 65 million total beneficiaries in the Medicare space. 33 million of them are still on original Medicare A and B. So that's 30, that's almost half of them are still original Medicare. They do not have a supplement and they do not have a Medicare Advantage to contain their costs because they're on the hook for 20%, no matter how high that dollar amount goes. But in the last year or so, we've clicked over, even though Medicare Advantage just started in 1999. Okay. 52% of the folks that are on plans now have Medicare Advantage. Supplements have been around essentially since Medicare was invented, but that segment continues to drop because these premiums are high and these premiums are low. I'm trying to advance this thing, but it won't go. There we go. So quick and simple, what are the contracting requirements for you to sell Medicare Advantage or Medicare supplements? You have to have a health license. You have to contract with carriers. Straightforward and simple. So if you're interested in selling a Medicare supplement plan or interested in getting into the Medicare space and understanding the questions and the answers and so on and so forth, Medicare supplement is a great place to start. Okay. Medicare Advantage or Part C. There's a few steps in that process. You still have to have your health license. You will need to go out and get an AHIP Medicare certification. Those are required annually. It's the same. I've been taking this test for 17 years. It's the same test over and over again. They just changed the name to protect the innocent. Contract with carriers. After you've completed your AHIP certification, they will not contract with you unless you have an AHIP to show them. And then you will certify with each carrier annually.